Hello, friends. Welcome to your show, Karunamai Sita channel. And today I welcome Dr. Madan Gulati from India. He is an Ayurvedic doctor and he has a lot of expertise in diabetes, specifically dealing with diabetes patients and reversing several cases of diabetes. And I'm honored to welcome him on my show today so that we can discuss about how Ayurveda helps to heal diabetes. And we will start by welcoming him on the show. Thank you, Dr. Gulati, for being here with us today. And I hope to learn a lot from you today regarding diabetes and Ayurveda. So if you could tell us, Dr. Gulati, a little bit about what diabetes is according to Ayurveda, what it means, and how Ayurveda is able to help, like any of your successful stories where you reversed diabetes cases. So I would really love to hear something about that.
Okay. So what is diabetes mellitus? In Ayurveda, there are 20 types of prameha. One is a bigger term that is called prameha. Prameha is the real word. That is, there are 20 types of pramehas in Ayurveda. That when the urine is sweet, it's called madhume. So one of the type of the prameha is madhume. Prameha is a big term. We see the urine, the color of the urine. On the basis of color of urine, there are 20 types of prameha. And madhumeha, that is diabetes mellitus, is one of the prameha. The prameha is of 20 types. 20 types in Ayurveda. And there are 10 types related to kapha, 6 types are related to pitta, and 4 types are related to vata. So madhumeha, that is the diabetes mellitus, is really a term used for the this madhumeha and diabetes mellitus. Are madhu means the sweetness in the urine. Madhu means honey like urine. So that type of disease which is related to vata, you should know what is vata, pitta, and kapha, because without knowing the with vata, pitta, and kapha is our potential energy, and this pitta is the thermal energy, and vata is the kinetic energy. So the diabetes mellitus is, according to Ayurveda, is a vatic prameha that is related to the imbalance of the kinetic energy. No doubt the root cause of the diabetes in Ayurveda, they say that it is related to asya sukham. Asya sukham means when the sedentary lifestyle is there. Asya sukham, then swapan sukham. That is the swapan means when you have the excessive sleep. That's called swapan sukham. Asya sukham, swapan sukham, dadini. Dadini is for curd, that milk, dairy products. All dairy products are the root cause of the diabetes mellitus. So according to Ayurveda, dadi, this curd, you call it yogurt. Yogurt is very, very bad for the diabetic patients. So all the dairy products like cheese, the animal-based products are all very, very bad for the diabetes mellitus, because they have written that gramya of the domestic animal soup or meat of the domestic animals, meat of the anup means which live in the water, aquatic animals like fish, and the soup or meat of the domestic animals, the root, and then there is the meshy land that is in the near the sea, that type of places where the animals living in that part of that's called anup in Ayurveda, anup rasam pyasi. Then they have shown that the Gramyodik anup rasam pyasi, then this jaggery products. Gramyodik. Then navan is, that is the wheat and rice. They are the new cereals. The old cereals are the foxtail millets, kodo millets, little millets, barnyard millets, brown top millets. These type of original cereals are wonderful for treating the diabetes mellitus. According to Ayurvedic view, the cereals like this wheat and rice, they have the high glycemic index, and that is very, very bad for a diabetic patient. Then animal products, all animal products, even milk products are not good for a diabetic patient according to the Ayurvedic principles. And jaggery and the products of the jaggery, their sweets, chocolates and all that, these are not good for a diabetic because they increase the glucose level. So what type of, in Ayurveda, they have written that there are three types, that is Sahaj, that is from congenital diabetes, then Kulaj from the families, and then that is acquired, that is diabetes mellitus. That is, one is the lean people and obese people diabetes. In the same way, the modern system of medicine says that diabetes mellitus type 1 and type 2. Type 1 is in the children and in the lean people, where the insulin is not being produced by the pancreas. So that is only 5% of the population is suffering from type 1 diabetes, and 95% people are suffering from type 2 diabetes, which is very, very common, and all the obese people, they are having. So this is the challenging problem. Then there's a gestational diabetes, which is during pregnancy. It's a temporary phase. So the main type of diabetes, which we will discuss today, that is type 2, which is very, very common. That is diabetes mellitus type 2. That is seen in the obese people. So that type of diabetes is, we cannot cure it without knowing the root cause of the diabetes. What is the deeper cause of diabetes? We call it as a carbohydrate metabolism disease, but no, I don't agree with it. I say that it is a disease related to the fat metabolism, because in type 1 diabetes, the insulin is not there. The pancreas is not being able to produce insulin. But in type 2 diabetes, there is a lot of insulin is produced by the pancreas, and there is insulin resistance. Insulin resistance is the root cause of the diabetes mellitus type 2, because it is a metabolic syndrome. So the main correction of curing the diabetes in my practice, I use to do this insulin resistance. I give the medicines to reduce the insulin resistance only. So insulin resistance is due to the excessive production of the insulin in the body. So it is too much insulin is there. So we have to reduce the insulin. I have seen that conventional people, they are giving medicines which increase the insulin, even to the type 2 patients. That is absolutely wrong. They should not be given. They should be given only those medicines which can reduce the insulin resistance, and there should be less insulin. So the main point, which I have divided it into three types. One is the excessive fat. That is the root cause, when there is a lot of fat on the abdomen, as well as in the liver, as well as in the muscles. So when the fat is more, the more fat is deposited in the intramuscular fat. That is the root cause of because that insulin, the key, which is the key, when it enters the cell, the receptors, it is blocked due to the excess fat in the muscles, and that is the root. We have to intramyocellular fat. Intramyocellular fat is the root cause. So we have to stop giving the patient anything which is related to the fat. Not excess fat should not be given to the patient. So intramyocellular fat is very, very important to reduce the insulin resistance. The second point is that we have seen that there is the acidic media, inflammation. Inflammation is the root cause, acidic media. So this is the cause of the inflammation in the body. When the pH value is less than 7, so there will be inflammation, and that is also one of the cause of the of diabetes mellitus type 2. And third one is the main factor in the diabetes mellitus is that intramuscular fat, and then acidic media. Then there are some micronutrients like vitamin D and vitamin B12. They are very, very important to win over the diabetes mellitus. So 4 factors are related to the diet, and which I have told that fat, and then acidic food, then lack of micronutrients. So then there is very, very important that there's a stuck in the exercise, there is a stiffness in the body, the stiffness and swelling in the body. That is, we have to reduce that. In the muscles, there is a swelling, and there is also the strength of the muscles is very low. So that's why the need of exercise, and most important part is the mindset, that is this stress level. When the stress levels are more, the diabetes as well as the hypertension both are increased. So we have to take care of the mind. We have to take care of the body. Exercise is very important. Then diet. So diet, we have to reduce the excess fat, and by eating the meal again and again. And I have seen that if we want to reverse the diabetes mellitus, we have to give the food like, that is, we should not give him food again and again. Because if we takes after 2 hours, if the patient takes the food, then there will be more insulin, and there will be more insulin resistance also. So that is not a right way to cure this problem. We have to do the intermittent fasting. There should be a big gap of eating meals, at least 12 hours to 16 hours gap is very, very important to cure. So fasting is very, very important in curing the diabetes mellitus. So I have seen that if we stop giving the dairy products, the animal food, the patient becomes vegan. Total vegetarian diet, he should take lot of nuts, lot of fruits and vegetables. They give us micronutrients, and they are free from the fat, they are free from and the food which is not having the glucose, this fruits, they have the fructose. So I generally give the patient to take lot of almonds. Almonds is wonderful for diabetic mellitus patients. And then there's walnuts are wonderful. Then cashew nuts are wonderful. Groundnuts are good. So all these things, this black gram, that is the Bengal gram, it's a miracle for the diabetic patient. And I recommend the pulses, that this we should put this pulses into the soak into water for one night, and then make a poha, that's a pura, that is called, you can make and that smoothie is wonderful. Smoothie of the fruits as well as plant, because the leaves of the plants like chulai, like spinach, all these leaves are wonderful for diabetic patient, because they have the micronutrients like magnesium and the sodium, potassium, calcium, all these micronutrients, as well as vitamin B12, which is being manufactured in the gut. So that is the very important part. The health of the gut is very, very important. We have to take care of the health of the gut also. So micronutrients like vitamin B12 is produced in the large intestine. So when it is vitamin B12 is, because this is produced by the bacterial action. All the fermented food is wonderful for a diabetic patient. We give this fermented food to the patient, and all these preparations like the smoothies. We give the amli, that is the fermented millets. We recommend the patient to take fermented millets, so that the vitamin B12 is being produced naturally by the action of the bacteria. So this helpful bacteria, they are very, very important to maintain the diabetes mellitus. So one of the way to win this disease is to give this 5 type of millets. That is, one is the foxtail millets. We call it in India, we call it kangni. And then one is the brown top millet, that is the hari kangni, that is green kangni is known in India. And then there's the little millets, then there's barnyard millets, then there's the kodo millets. All these 5 type of millets we give for 2 days brown top millets, 2 days kodo millets, 2 days barnyard, then foxtail, then little. All these have to be given for 2 days. So I give the patient this from the morning to evening. I give the diet chart. Either he should take in the early morning, he should take smoothie of the sugar, that will make the media alkaline. So acidic media is very, very bad to cure the diabetes mellitus type 2. So in Ayurveda, we give for example, we give this Karela. Karela is not good for type 2 patients of diabetes. Fenugreek, that's methi, is wonderful. Methi we can give this ajwain, we can give this garlic, we can give ginger. Ginger is a miracle. And this turmeric is a miracle in according to Ayurvedic principles.
Karela,
This amla.
Karela can be given to type 2 or no?
It is not good for type 2 patients. It is wonderful for type 1 patients. For type 1 patient, when the pancreas is not producing much insulin because it's a plant-like insulin is there. So milk is very, very bad for a diabetic patient because milk contains IGF, insulin-like growth factor. This is the root cause of the diabetes mellitus. So when we stop giving milk and dairy products, any animal food is a poison for a diabetic patient. According to Ayurvedic principles, we should never give a diabetic patient this animal food. The animal food, because plant-based diet, total vegan diet is a miracle. For example, coconut water or cashew nut milk, coconut milk, groundnut milk, we can make all that things. That is very, very important to give that. This IGF is very important. The insulin-like growth factor that is in the milk. So when we give this Kerala, that is the Meriscia chaita, this is very, very, because it will increase more insulin. And type 2 patient, insulin is already more. So the medicines which we have seen in the conventional system, like glimepiride or all this glimepiride and all that, which increase the excretions of the pancreatic juice, increase more insulin. That is not good for a diabetic patient. So leptin resistance and insulin resistance are the two major factors which have to be taken care of. So according to Ayurvedic principles, we should give this Indian gooseberry and this turmeric. The combination of turmeric and Indian gooseberry is a miracle according to Ayurvedic principles for type 2 patients. And ginger is very good. We have to concentrate on the metabolic syndrome, the obesity. We have to reduce the obesity, like Medohar Google, like the medicines which contains the Google preparations are very good for a diabetic patient. Shilajit is very good. Then we give this Basant Kusmaka Ras. It gives energy to the body. And the medicines which are based on this Kerala, Jamun and Nim, because all these are Vatic, they increase Vata. So for type 2 patients having diabetes mellitus, this Kerala is not good, this Jamun is not good, and this because it is for type 1 patients, they will increase more insulin in the body. We don't want more insulin, we want to reduce the insulin level. For a diabetic patient, I think if the insulin is less than 2 to fasting insulin is very, very important to check the patient suffering from diabetes mellitus. The fasting insulin should not be more than 4. It should be between the 2 to 4. And the vitamin B12 should be more than 450. And vitamin D should be more than 60. So vitamin D is very important. These are the micronutrients. I have already told that the diet is very, very important. One is IGF. The IGF means insulin-like growth factor. That is in the milk. So we should stop milk. Then we should stop giving the patient this. We should give more micronutrients. That is in the smoothie. You see the leaves of the plants. Like I recommend that one plant, like one day this spinach, one day this cholai, this amaranth, one day for the bathu. All these plant-based leaves, and they are the major leaves. And there are also minor leaves. Minor leaves are like coriander, like mint. So these should be put like this moringa. They are very good. We give the smoothie of the plant, of the leaves of the cholai or bathu or this, this palak. Palak is spinach. So all this, one day spinach, one day the leaves of the beetroot, leaves of the carrot, leaves of this mooli, radish. These are very good. One day radish, one day smoothie of the spinach, one day this carrot, one day beetroot. The leaves of the beetroot, they are very, very good because they contain magnesium, a lot of magnesium. And instead of iron, the difference between the chlorophyll and the hemoglobin is just the structure of the chlorophyll as well as the structure of this hemoglobin is the same. The only difference is that there is a iron in the hemoglobin, and there is a magnesium in the leaves, that is the chlorophyll. So it's wonderful. It's a plants and Jimny. This is known as the nectar of the nectar. the plant blood. We call it the plant blood. So the smoothie does work like a miracle, because we give the this leaves of the spinach, or leaves of amaranth, or leaves of radish. These leaves we have to put as a major leaves, and then we should put some minor leaves like mint and this coriander, and we can put tulsi, this basil leaves, and we can put this pan. Pan is also wonderful. Betel leaves are very, very good. So all these should be put together, and we can put small some apple, or some pomegranate, anything, or we can guava, any fruit. We should put some fruit leaves and put some dalchini. Dalchini is miracle. That is cinnamon. Cinnamon is a miracle in Ayurveda, according to Ayurvedic principles, because this is shrota growth. There is a blockage in the channels due to the inflammatory process. So we have to check the inflammation. For that, this cinnamon is a miracle. Then this flax seeds are also doing very, very well. So we put flax seeds also. We put this chia seeds also. They are very good for the, because then there should be layer of the in the stomach. So all these things, which when we give in the form of smoothie, one time when we give the smoothie to the patient, and that's ashgard is wonderful, because it reduces the acidic media. In the acidic media, when there is acidic media, the insulin resistance will be more. So acidic media is also one of the cause to increase the insulin resistance. The root cause, we have to concentrate on the insulin resistance only, because anything which causes more insulin in the body, there will be more, the type 2 diabetes will be increased, because already the cells are full of glucose, and the cells don't want that any glucose should come inside. So that is, glucose is not, we should not give the glucose to the cells don't want more. So that's why they put a lock, resist that, they make the resistance. The same is the case with the leptin. Leptin is also one of the root, because when the more fat is there, leptin resistance will be there, because leptin is produced by the fat cells. So leptin resistance and insulin resistance, these are the two major points for the reversal of diabetes. If we want to live with diabetes, then we should do that. One should eat after every 2 hours, But if you want to reverse the diabetes mellitus, the most important way to reverse the diabetes mellitus in type 2 patients is to have fasting. The fasting is the real answer because when there will be less, when we eat less, there will be insulin will be less. So insulin, we have to main concentration on this. We have to reduce the insulin level in the body. So the treatment, which is generally anything which will increase the insulin, that will increase the diabetes, the risk of the diabetes mellitus, the complications will be there. So how to cure it? The right way is to just give the smoothie of the early in the morning, the smoothie of this leaves, and mix some fruit, so that the media should be alkaline. Then the dry fruits like almond, then walnut, then cashew nuts, then this pista and all this dates, even we can give them, because they have the micronutrients. This is very, very important part of the treatment. Even I used to give mango to the patient, and I also recommend, because that contains fructose, more fructose, not very little glucose, but full of micronutrients. So I give mango to the patient of diabetes mellitus type 2, because in the early morning when they take the fruits, for example, a patient is having, the weight is about 60 kg, I recommend to give them about 60 grams of the dry fruits, like walnuts, cashew nuts, and almonds. And they should be soaked in water for 6 to 8 hours. And then even raisins, the dry grapes, they are very good. Even dates They are very, very good. We can put pumpkin leaves. We can put this sunflower, seeds of the sunflower and the pumpkin seeds. They are also very good. So in the early morning, they should take the almonds and all these dry fruits. And the breakfast should be the full of the, there are two ways to take the breakfast. One is to give only fruits. For example, a patient is having the weight is 80 kg. He can take more than 800 grams of the fruits before 12 o'clock. Before 12 o'clock, he should take this 800 grams of the fruits of various, like papaya or guava or apple or any fruit which he wants to take. So I recommend the patient to take a lot of fruits early in the morning, and then either if he doesn't want to take the these fruits, he can take there should be division. One is 400 grams of the salad, like this cucumber, tomato, or radish, or carrot, or beetroot, any veg he likes, and put some leaves and put some seeds into it. Make a chutney of this mixture of this mint and coriander, and then tulsi leaves or ajwain leaves. Ajwain leaves are also very carom seeds. So these are very good, carom leaves. They are very, very good. If we put in make a mixture of that and put into the salad.
Leaves,
so 50% should be the salad, and 50% should be the any this pulse, which is put into water for about 8 hours. That is the ideal breakfast. This we can make this puda, like what we call we make a paste of the pulses which we soaked in the night, and we make the paste of that, and then we can put a puda, or we can call it as a chilla. In India we call it chilla of the pulses. Any pulses like mung dal or masur dal, or you can jhuli hui dal, that's very good. We can give the chilla of that the pulses. So 50% should be the some little chutney. We can put some ginger, and we can put this mint leaves and tulsi leaves into that salad. And this methi leaves are very good. Fenugreek leaves and the moringa leaves are very, very good. Moringa, this is what we call it, moringa in the it's a miracle. It is full of iron. So this is, even in spirulina is very good. We can put in spirulina into that also. So these all green things are really very good. If we give in the early morning, we give either fruits or salad, 400 grams of salad, and then 400 grams this chilla of any pulses. So this is wonderful if we give to the patient of the diabetes mellitus type 2. So now the lunch should be having in 4 parts. One should be the 25% should be the salad, 25% should be any pulses, like any dal, we call it this any vegetable what the patient wants to take. 25% should be vegetables, 25% should be of the proteins, that is this dal, this pulses, and 25% of the cereals, and that is the ideal. It should not be of rice, because the glycemic of rice as well as this wheat is too much. So they should the fiber contents are just 2 to 3%, but the millets, they have the fiber content from 7 to 12%. So that is very, very important. If we give the brown top millet, or 2 days brown top millets, 2 day barnyard millets, 2 day kodo millets, 2 day little millets, 2 day foxtail millets, these millets do wonder. So if we give in the lunch, 25% millet, 25% any pulses, 25% any vegetable, and 25% salad. The same is to be repeated then salad quantity should be about, if a patient is having 80 kilogram weight, he should be given about 400 grams of the salad, either in the breakfast or and total should be 800. In the 3 meals, if he takes salad in the morning, then he can take the salad 400 grams of the salad in the lunch, and he can avoid this in the dinner. So if If he can take, if he has taken the breakfast of fruits, he has not taken the salad, then we have to compensate in the dinner. Then we will say that 400 grams should be taken in the lunch, 400 grams should be taken in the dinner. So that is the right way to cure a patient of diabetes mellitus 2. Regarding diabetes mellitus 1, and then there is a very, very important part along, because in Ayurveda we call yabi kriya vijyante shrire dhakvesma sachikitsa vikaranam karantas vishchamatam. Whatsoever you have to do this pranayam and this Kapalbhati, Anulom Vilom, and this from the taking breath from the left nostril and then leaving it from the right nostril. That's Anulom Vilom, and this Kapalbhati and Bhastrika Pranayam. Bhastrika, I recommend my patient to do Bhastrika Pranayam for 10 to 15 minutes, then Kapalbhati from 20 to 30 minutes, and Anulom Vilom for 10 to 15 minutes. So these 3 pranayams do wonder in diabetes mellitus. Even this asanas like Mandukasana. Mandukasana is wonderful. So Surya Namaskar is also very, very good for the diabetic patient, because the exercise is very important. Then this making the muscles in the gym. They should be, because instead of going for a walk only, it's not that good, because for the health of the muscles, one has to strengthen the muscles. Then the beating the body on for the when there is swelling in the muscles due to the there is a lot of stiffness in the muscles because of the lymphatic tissue. Lymphatic fluid is deposited into the muscle, and then we do that exercise by beating the body, by this beating, like you can say this just beating the body muscles. That works a miracle, because, and then anti-gravity exercises like going above against the gravity. 2 hours after taking the meal, and one should do this like climbing the stairs for about 120 steps, 120 steps. This miracle, because I have seen sometimes when there's a lot of PP is more, that the sugar levels are increased. We have seen that if the patient having the PP is about 200, after doing the steps for 120 steps, and it becomes like about 20 to 50 milligram, it's come down. Because I have seen that after 2 hours of the meal, that is PP, postprandial sugar, is when it is increased, we ask the patient to do this climbing anti-gravity exercise like Marcola or something against gravity. So that is very good for type 2 diabetic patients. Regarding diabetes 1, then there is a lot of Ayurvedic medicines which increase the insulin, that I have already told. That is the Screla is a miracle. That is all these climbers, and this jamun and this methi, all these are very good for because we have to increase the insulin. So for that, this milk is very, very dangerous for a type 1 patient, and all dairy products. The other regimen is almost the same. We have not to give the milk at all, because it is the in type 1 patient, because this is an autoimmune disease. It has been seen that it is due to some by the use of some antibiotics. It's a category of the autoimmune diseases, and that for that this animal food is against not good. But the medicines, they can be advised insulin also, but type 2 patients should never be given insulin at all, because the patient is already having more insulin. So this is the major difference, which is a major mistake which I see in the patient, that is why they have to take the medicine for whole of their life, and they suffer from the various complications. So it is not good that we are having insulin and this glucose in the body, and by giving the insulin, we are just putting it into the cupboards. For example, there is a lot of this anything which is unwanted material is in the body. So we, instead of giving it in, it should not enter, but we are putting it in the cupboards. So this is not the right way to give. For example, this is we give the jaggery of this, because whenever there is a insulin, this sugar is more in the blood, then insulin is more. So insulin will put into the various tissues. So definitely the sugar will come less in the blood. The reading will be less, but the sugar is in the body, not from the. It is not removed from the body. Previously, it was in the blood, and after taking the conventional medicines, we are making the cells and tissues. We are putting the sugar more into the cells by giving that type of medicines. So those type of medicines should be avoided. So a patient should go for the fasting in type 2 patients. For type 1 patients, fasting is not advisable at all. Fasting is not good because their insulin is not being produced by the pancreas. Those type of patients, they should be given frequent meals. They should not go for fasting at all. For type 2 patients, fasting is the real answer to reverse the diabetes mellitus.
So like you said that this is autoimmune disease, and you said that fat is the cause for type 2 diabetes, then
yes,
fat is not being metabolized. But then you said that
people are thinking that's carbohydrate metabolism. Okay.
But you said they can eat nuts like almonds and walnuts and raisins, but they also have fat. So
but they are having micronutrients. They are rich in they help in producing the vitamin D and vitamin. These are the micronutrients are in there. And that fat is not bad. The animal fat is real dangerous, because intracellular fat is in the animal food. And plants are not, the God has not given the plants to produce any cholesterol. All plant-based fats are zero cholesterol. But the animal food, this liver makes the cholesterol. The fat which we take from the animals, that is the cause of the high cholesterol, and that is cause of the intracellular fat. And that is the cause of the insulin resistance. The fat which is coming from the plant-based diet, that is not harmful at all.
But that is just for diabetes, or like everybody should avoid milk?
All other diseases also, because this animal food is because animal food is not good for even for cancer, even for high blood pressure, because the cholesterol, which is the animals can produce the cholesterol. The God has not given the power to plants to produce cholesterol. Plants cannot make any seeds, anything which is coming from plants. They have very, very good fat. That fat is not going to increase your visceral fat. That fat is good for our health. So if we take from the almonds, the glycemic index is very, very low. Glycemic load is very low. This is a miracle. I have seen that the patient who takes this cashew nuts are having zero cholesterol, big zero. So we can recommend the patient to take this nuts. Nuts are very good for the type 2 diabetic patients. Even for type 1 patients, these nuts we can give, because they are quite safe for them also. But they're not hindrance to the production of the insulin. They have their different role. In type 1 patient, we want to increase their weight also. But for the nutritious diet, because it is containing the micronutrients also. Micronutrients are very, very important, because in the nuts we are missing. Even in the fruits, we are giving the Mary biscuits, but not the fruits. We don't recommend them to take fruit. It's not good. It is better to give the fruits instead of Mary biscuits to the patients suffering from diabetes mellitus.
Okay, you can give them fruits.
Certainly, they should be given even dates. I give the raisins also. I give the grapes. I give chiku also. This sprouts, we call it sprouter, or pomegranate also. This orange fruit. All fruits are good for diabetic patients, because they are not bad at all. Instead of taking this as a substitute of the grains. The grains are the real culprit. You must have noticed the book written by this Dr. Perlmutter. He has Brain Grain. It's a very popular book. He has clearly mentioned that the grains are real. There's a book also, Wheat Belly. The wheat is the cause of the increase in the fat on the belly. So these carbohydrates are converted into fatty acids, and then the visceral fat is increased. So main culprit is the animal fat and carbohydrates. So we have to not give to the animal fat, the fat which is coming from the animals. That is not for, like cheese is not good for a diabetic patient. Like fish is not good. Like eggs are not good. Instead of taking, they should take a lot of soybean, and they can take this this pulses or grams, black grams. They are very very good. Besan is very good.
Besan is good. Okay. For type 2, and for type 1, there's a difference that they can take Karela, but type 2 cannot take Karela.
They should not be given because it is a Vatic disease. Vatic increase the Vata. They will go for, because Karela and Jamun, these type of things which are they produce the Vata in the body. So these are not good. And I have seen in my daily practice that they suffer from the paralysis and all these type of problems, neurological problems like sciatica after taking Karela and all that, because it is a Vatic Parmeha. The basic point is that it is because Karela is bitter in taste and increases Vata in the body. So diabetes mellitus is Vata disease, Vata. It is related to Vata. Even Jamun is also this Kishaya means astringent. It also increases Vata. So we have to take care that patient should not be given. This methi is equally for the two, for type 1, type 2, both. This methi is wonderful. This plant of this Sadabahar, Vinco rosea, Vinco alba, they are good. And Alsi is also good. Alsi is Alsi, flax seeds. Flax seeds are good for type 2 as well as type 1. Because they increase the insulin, but at the same time they reduce the insulin resistance. It is good for the metabolism. So some plants are useful in the type 1 as well as the type 2. Saptrangi is a plant that is good for the type 1 patients. Because in type 2 patient, the main aim is to reduce the obesity. Main attack is on the obesity, that fat, this insulin resistance and leptin resistance. Leptin resistance is the root cause of the of diabetes type 2 patients. So leptin is very dangerous because it is produced by the fat cells. And,
but if it is related to fat, then isn't it a kapha disease more than a vata disease?
This
type 2.
I'm not following this.
Type 2 you said.
Basically, it is in the classification, because Parmesi Kapha. Parmeya, all kapha, kaf Krishnavam. This shloka in Ayurveda, it's for Parmeha, not for Madhumeha. It says that all the kapha related diabetes mellitus is converted into, because there are 10 type of Parmeha. According to Ayurveda, there are 10 type of Parmeha, kapha Parmeha. The kapha related Parmeha all converted into diabetes mellitus in the later stage, because there are 11 factors in the, and like the dosha is vata. The main cause of the diabetes mellitus is the vata, but there is importance of the mido dhatu, because dushya, that is called dosh and dushya. Dosh means the root cause, that is related to vata, but dushya is all the dushyas are of the kapha nature. So according to that, the medo dhatu is leptin, medo is fat. So medo dhatu there is a obstruction due to medo dhatu. There is a lot of the dhatu is dhatu and the dosha. They are two different things. In Ayurveda, we believe in dosh as and dusha. These two terms are very, very important to understand. Dosh is vata, but dusha is of kapha nature, that is medo. 11 type of this rasa, even rasa is also dusha. Rasa the dhatus are involved in this. They are of the kapha nature. Medo dhatu is involved. Rasa is involved. So even updhatus are also. Snayu is involved. These are all of kapha nature. Dushyas are of kapha nature, but the dosh is the root cause is the vata. So we have to take care of the vata as well as dusha. So fat is not good at this. This leptin is no doubt. Leptin is the dusha, like medo. In Ayurveda we call it medo dhatu. Medo dhatu is like leptin. So Medo Dhatu is that is the Samprapti. You know the pathogenesis of the disease. We have to understand it, the pathogenesis. The cause, the dosh is Vata, but Dusha is the tissue involved is of the Kapha nature. The tissues involved are Kapha. That is why we call it intramuscular fat. Intramuscular fat is of Kapha nature. Dusha is that. But the cause is Vata. We have to take care of the Vata first, and then we have to take care of because obesity is due to the Kapha as well as Vata, because this disease is of the Vata nature. So that is why I am saying that this Kerala and this, they should not become big. They are the plant insulin. We call it as plant insulin. They work as the producing the insulin. So when the patient is, when the pancreas is total fail in type 2 patients also, then it can work little it can work, but that stage never happens, because if we give the right way to treat the patient, we will not get this problem of this, and their pancreas will be overburdened. It will be, the pancreas never dysfunction, because by giving the medicines, the pancreas stop producing the insulin. So then it is sometimes in type 2 patients, when they don't, they are putting the medicines like metformin and all the time, and this glimepiride and the sitagliptin, and then they put on the insulin. This type of treatment in type 2 patients is just, they are always taking the medicine throughout of their life, but they never get rid of the disease. I have reversed the patient of diabetes mellitus too, by stopping their modern medicines and by giving them the principles of Ayurveda. That is, we take care of the Vata, and the Sant Kusmakaras is the disease drug of choice for the Vata. So we have to take care of the Vata first. We have to take care we have to keep in mind that the Vata should never be increased, because the Vata will increase, the patient will have the more complications like paralysis and the sciatica and all that. It is due to Krela named Jamun. When we give type 2 patient Krela named Jamun, they suffer from the sciatica problem, they suffer from the neurological problems like Parkinson's, and then paralysis, and then all these 80 type of Vata. Then Vata is vitiated. Vata is the most important part in curing the type 2 diabetes. We have to take care of Vata, that is kinetic energy, and that is only possible if we, that is why turmeric is very good. That's why this amla is good, because they don't increase Vata, as well as they reduce the Kapha. So medicine like this fenugreek is very good, because it's also good for the Vata as well as for the Kapha. So we have to take care of the Vata as well as taking care of as a dusha of Kapha nature. So the balance we have to make, but we have to keep in mind that Vata should never be increased in type 2 patients.
Okay, but this is the diet chart just for diabetes patients, or like if a person like you said like no dairy products, so no dairy products just for type 2 diabetes, or like they cannot take ghee as well?
Type 2 patients, ghee. All dairy products are not good. Even this buttermilk is little good, because it increases it's fermented milk. The bacterial action is there. When the bacterial action is there, they can take very little. In the lunch time, they can take some little buttermilk. But according to pure desi ghee, this is called the cow ghee. And you want to say that cow ghee is good for the type 1 patients, not for type 2 patients, because that will again increase their intramuscular fat, because it is animal-based fat. Plant-based fat, they are good. Plant-based fats, like from the fat which is come from the nuts, that's a miracle.
Okay, they can eat avocado or no?
Avocado is also good. Avocado is for type 2 patients. For type 1, it's wonderful. For type 2 patients, we can give in the category of fruits. We can give, because they contain so many micronutrients and some minerals also. So avocado is good. I don't say that it comes in the category like this guava we give in India, and they give this avocado in the Western country. So it is good. We can give them, because it will not increase Vata. Even pure ghee is, according to Ayurvedic principles, Ghitam Pit Anilaram Rashtukar Osam Hitam. Ghita, what they have said, that the Pitta and Vata, they it reduces the pitta as well as vata. In that point of view, it is good for that. But because it is it increase the leptin, because leptin is increased by giving the any fat from which is come from the animal. So leptin resistance, if we think on the leptin resistance, then it will be harmful. But in small quantities we can give. It is you can give it according to Ayurvedic principles. It reduces vata when there is complications like there's a paralysis type or something related to neuropathy. Then we can give this pure desi ghee and this clarified butter. Then we can give. Okay. When there's complications of vata, to cover the complications of the diabetes mellitus, we can give. Like he's suffering from some paralysis, or like Parkinson's is there, some other problem related to vata is more, then we can give, because ghit is good for the vata, but at the same time it is good for pitta. This is a very complicated disease, madhumeh. According to Ayurveda, they say that it is all these three doshas, because mainly disturbances of vata, but the doshas of the kapha nature. And pitta is also, because inflammation is and acidic material is due to pitta. So all the three doshas are involved in this diabetes mellitus. The main is vata. Involvement of pitta is there because acidic inflammation, acidic media and inflammation is only due to pitta. And kapha nature is due to this, when there is a intramyocellular resistance, when there is intramyocellular fat is there, then involvement of the kapha is there. It shows that this medo dhatu is dushit. This medo and ras dhatu, this mas dhatu is also not. Mas dhatu is because dhatus and this is there are 13 this 7 types of dhatus are there. They are the dushyas. All the 7 dhatus are vitiated in the diabetes mellitus. But when they will say that dosha, which is the dosha, the main dosha for diabetes mellitus, that is vata. So we have to take care of vata very, very. We have to take care of vata as well as we have to take care of the doshas, that the dhatus. Dhatus and doshas are quite different. Dosh is vata and dosha is 7 dhatus and of the kapha nature. So that is why we have to the very, very balanced treatment. You have said that ghee should be given to a type 2 diabetic patient. Very little, very, very little. But they can be given. Instead of giving the refined oils, it's better to give them clarified butter. Refined oil is very bad, because clarified butter contains so other nutrients, micronutrients, that helps. That's why it is according to Ayurvedic principles, Ghita is one of the best thing for our overall health. To avoid the complications. For example, this complication, the eye neuropathy, this retinopathy, then we gave the trifluagrit. Trifluagrit is very good. When there is complication of the diabetes mellitus as there, we have to give the trifluagrit also. Saptamatlo, trifluagrit, amrit kalash. These are the things which we give when there are complications of diabetes mellitus. But why that stage should come. We want that it should be reversed. For reversal of the diabetes mellitus, we have to, for example, if we say that fasting is good, but fasting increases vata. So we have to take care according for reversal of the disease. Fasting is good. Intermittent fasting, not very long fasting. Intermittent fasting is very, very good, because anytime when the increase, again and again we are taking meals. Every time we take the meal and the insulin will come. When the insulin is more, it is going to deposit more and more glucose into the cells. Cells are already full of the glucose. So it is that is the vicious circle. So if we take meals again and again, the more insulin will come and it will increase the insulin resistance, which is the root cause of the diabetes mellitus type 2.
Okay. But you do give trifluagrit when in type 2 diabetes as well.
When there's we give the nisha means this turmeric, nisha amalki. Nisha amalki is a very, very good medicine for the nisha amalki. Nisha means the turmeric, haldi, and this amalki means gooseberry, Indian gooseberry. And when there is a complication like cataract and this optic neuropathy is there, When there's a nerve involvement, then we give this Tiflagrit and Saptamatlo. Saptamatlo, we give Sant Kusmakaras, we give even Yogendra Ras also. When there's a retinopathy, it depends upon the complications, because diabetes mellitus is not, it's a condition. Basically, it is not a disease. I don't take it as disease. It is, according to Ayurvedic principles, it is just ajiran. Ajiran, you know, when there is a disturbance in the digestion, when the patient is taking meals again and again, and it is not being digested, and we are taking again, putting the some again and again, that is the ajiran. And in Ayurvedic principles, it is also mentioned that the diabetes mellitus is due to the ajiran, indigestion. It is the basic cause is the indigestion. When we are not taking we are not digesting the meal properly. So that is going to increase your vata. Vata is also ajiran is of Vishtabda Jiran, Vitagda Jiran, and then this Vishtabda Jiran is vata, when Vishamta of the internal fire. That is Visham. Sometimes it's more and sometimes less, and that is the cause of diabetes mellitus. When we study in the Ayurvedic principles, then we see that the Vishtabda, this vata is, why the vata is increased? When there is irregularity. We are taking, sometimes we are at the different times, and we are taking, our stomach is full, and then we are taking again and again something we are taking, and then that will increase vata. There will be the Vishamta. Vishamta means imbalance of vata. So that is also in Ayurvedic way of thinking is that it should not be, one should take the meal that after the proper digestion. If there should be gap of at least 4 to 6 hours between the lunch and dinner. And the dinner should be taken early as possible. So that if one takes dinner at 7 or 8 o'clock, then he can do for the next day, he can take the principal meal at 10 o'clock. The breakfast should be at 10. So there should be gap of 12 hours, because there should be enough rest. Because according to Ayurveda also, we believe in this diet, and then brahmacharya, that's celibacy, and then one of the pillar of the health is this proper sleep. So sleep is also a very, very important role to play. And then the stress has a big role. Stress, when there is this mental stress is there, too much stress is there, then the diabetes mellitus will out of, because modern principle also says that adrenaline level will be more, and the more adrenaline, cortisol will be produced, and then when we are under stress, more glucose will burn, and the blood will be full of this glucose, because even the muscles and even the fat cells will be converted into the glucose. They will be because stress is very, very harmful in diabetic patients. Similarly, that increases vata. Again, krodhat pittam bhayat vayu. When there is a fear in the body, vata will increase. So diabetes mellitus is a vata disease. So when there is a fear, when there is a person is not happy, when one has to take something sweet, when he's not internally happy. We want to take something sweet because mood decide our food, and food decide our mood. This is the concept. Because when we are not happy from the inside, we are not sweet from the inside, we will like to eat something sweet. So the mood is also that is why the happiness has a big role to play for the health of the diabetic patient. But so vata, this should be internally. It should not always be under anger.
Vata decreases with sweet though, like madhu, like vata is supposed to decrease with sweet.
Yes, you are right.
In certain vata cases, in diseases, they recommend having more sweet because to decrease the vata aggravation, right?
That's right.
Not in diabetes, but like in other cases.
But not in diabetes. Diabetes mellitus is related to, because there's already sweet things are not, the sweet fruits are good. Because I just want to make it clear that there is a difference between the sweets from the fruits is wonderful for a diabetic. That is, the sweets from the fruits are different. The sweets, because there's a difference between the lactose, glucose, fructose. The fructose is good for a diabetic patient, not bad. But glucose is very, very bad. When we we say GTT, glucose, how much glucose is there. But we never say that how much fructose is there. We are testing the glucose. Glucose is very, very harmful for a diabetic patient, not fructose. Fructose is good. There are so many type of this starch is divided into, then becomes a very big topic that how many types of starches are there. But in a nutshell, I can say that the sugar which is coming from the fruits is really, really very, very good for a diabetic patient because it reduces vata. Because when we give this dates reduce vata. Mango reduces vata. Vata and pitta both. Mango is very good for a diabetic patient. But it is a sweet because it is going to reduce your vata. It is having, no doubt, it is having fructose, more fructose, very little glucose in the mango. So in that point of view, that we can give mango to a diabetic patient. But sweets means chocolate is not good for a diabetic patient. That type of sweets are not good, which are based on this animal food. Chocolate is again from the animal food. Even coconut is natural sweet. Even ashgard is natural sweet. Ashgard is very, very good for the diabetes mellitus. Ashgard, this pumpkin, this white pumpkin. In India, we call it agra petha. It's very good. It's good for, but not sweetened. It should not be sweetened with the jaggery or something, sugar. Sugar is not good. Sugar is glucose. But the fructose is, when we go for the testing the diabetic patient, we see we always ask for the glucose. How much glucose is there? Not ask for how much fructose. Fructose is not going to react with insulin. Insulin is to come only when there is glucose, more levels of glucose. Our blood has only 5 grams of glucose, and our muscles have about, you can say, 500 grams of glucose we can put into in the muscles, and 100 grams of glucose live in the liver in the form of glycogen. And ultimately, it's converted into triglycerides and this fatty acids. So glucose, the main problem is with the glucose, not with the fructose. That is why what we are saying that sweets are good for diabetes. Yes, the sweets from the fruits are good for the diabetic patient.
Okay, so they can have that. But so
even banana is good. Banana's glycemic index is less. Instead of taking chapati, one should take banana in the morning, early morning. Banana is not going to harm because it is again reduced vata. And it's good according to modern system also, it's good, rich in potassium also.
Somebody who doesn't have diabetes, can they, like, I'm not talking about like cheese or butter, but like somebody who doesn't have diabetes, can they still drink milk?
The person who is not having diabetes, he should take milk or not?
Yeah.
I would not say that one should take milk because now it's a white poison. I call it as a white poison. This is because of many, because we put so many, just inject the animals with so many steroids and all that, oxytocin and all the process of producing the milk is one of the cause of why I don't say that one should take milk, because milk contains IGF, insulin-like growth factor. And that is a cancerogenic, that is carcinogenic. It has been proved that the calcium from the milk is not at all good for the human being, because milk is for this own child, not for the other mother's milk is the good. That is when there is no teeth, then one should take milk, and that is only of the mother, only of the own mother, not of the other animals, because they contain different type of hormones and they are going to harm the body. So I don't recommend to take milk, even if a person is not suffering from diabetes mellitus.
Okay, even if they are taking like organic and from the desi guy, from proper.
Yes, you can give that type of milk. You are taking milk of your own. You have put the animal and you are giving feed. You are feeding feed. You are not giving any injections to the animal. That type of milk you can give. That is really good if you can arrange that from the grass. They have taken the grass and then they have. But ultimately, in the other sense also, because the animal, the milk is for this own child. This even desi guy gives the milk that have the hormones that we want our child that he should not grow like this ox. We want that the growth of the child, because the growth factor is even in the purest form of milk is also having that IGF. IGF is not good for our health. Insulin like growth factor is there in all type of milks, even from the desi guy also, because
because it's very confusing, because I read on this American Cancer Society website that dairy products, they cause cancer, they cause prostate cancer.
This is all industrial,
but they decrease colorectal cancer, because there is a lot of other things in milk, like the calcium in milk is supposed to decrease colorectal. Like I just saw, I read it on the American Cancer Society website.
There is a Neil Bernard study. You can say Lord Gabriel, you might have read the name Neil Bernard. Neil Bernard says that it is not good. Neil Bernard, there's a book on this milk. So I have seen that even in Ayurveda, we used to say that milk, but it's logically that we should understand that the mother have the human milk is different from the milk of the other animals. No other animal takes the milk of the other animal. Have you seen any animal that is taking the milk of the other animal? Why we take? Because that milk is the calcium in the milk is not that good, because the cow or animal, this buffalo, they eat grass, and the grass is full of calcium. If we take this spinach, the leaves of the different plants, that type of calcium is very, very good for our health. This type of calcium, which is from the milk, which will cause the kidney, this gallbladder stone, that cause the kidney stones, they cause even osteoporosis. One of the studies is also saying like that the milk from the calcium, which is we take from the milk, is the cause of the osteoporosis. It has been seen that the persons who are taking milk of the animal, osteoporosis is because they take the calcium from, because milk is ultimately converted into lactic acid, and lactic acid is again acid. To maintain the pH value, the body takes the calcium from the bones. Instead of increasing the calcium, we are reducing calcium in the body by taking the animal milk. Because milk is the end product is lactic acid. It is acidic again nature, not alkaline. So we have to maintain the alkalinity of the body. pH value is very, very important. Milk is going to disturb the pH value, because it will increase the to the acidic media, because it is ultimately converted to lactic acid. That is very, very important factor. We always miss this point, because it is when we take the milk, it's alkaline, it is antacid. But when it goes into intestine, large intestine, it will convert into the ultimate end product is lactic acid. So lactic acid will increase the acidic inflammation will be there. When the inflammation acidic media is there, the calcium the blood, to maintain this pH value, the brain will give the signal to the bones that give me more calcium, that becomes the osteoporosis. I have seen the patients suffering from the osteoporosis. I just ask them not to take milk. They will get relief from the joint pains and the bone problems. Even osteoporosis, osteopenia, I recommend the patient don't take milk, and their osteopenia is okay, because the calcium from the bones is, because after the acidic media is reduced. When we stop giving milk, there will be no lactic acid. Lactic acid is not there, so the alkalinity will be automatically maintained. But when there is lactic acid, blood becomes acidic, and it will take more calcium from the bones, and they become the osteopenia or something. Osteoporosis is there, because we are getting calcium from the bones to maintain the alkalinity of the blood. So we should not give that animal-based calcium, because the calcium should be from the plant base. This soil is full of calcium. You know, we used to take slate, and this child takes they eat meat. Why? That is the biggest source. The tuna is also the biggest source of calcium. The plant-based calcium is miracle, like talish patar, like talam khana, Vanshlochen. So type of the leaves, the calcium taken from where the animal takes the calcium. You just tell me. They take from the grass, and grass is full of calcium. That is the equivalent of the grass is this leaves. When one shapes bringa leaves and spirulina, one is taking this chalai, some methi. All these leaves are rich in calcium. This still is full of calcium. This the plant-based calcium is miracle, but the animal-based calcium I don't recommend at all for even other diseases.
Okay. Okay. Sure. So
it's really interesting. It is something different. Because I also used to think that when will take milk. Milk is when the teeth are not there. When the teeth up till even in Ayurvedic text, they say that the shir anad. When we say the shirad means when the child is taking milk only. Milk is for the child below 2 years. When we are having teeth, why we should take the milk of the other animal? We are not taking the milk of their own mother. And the mother's milk is good. That's wonderful, because that is the hormones which we need. That is from the mother, that we get from the mother. But the hormones of the animal, how can they be helpful for a human being? That animal, this growth hormone is for that animal. You know that the child having 4 legs, that is the calf. We are not going to make the cows by giving the milk of the cow to the small children. The children has to become like their parents. They should not become the calf or this cow, because this is not advisable at all. Because why we take, when you recommend this vegetarian food is wonderful. I say that vegans are suffering from less, even these corona cases. I have seen, there's a study also. The patient who are taking the animal food, they are more having the complications of corona, but who are taking all autoimmune diseases are related to the animal food. And if we want to get rid of the autoimmune diseases, we have to stop taking animal food. We have to take the plant-based diet, and that is the vegan diet. I strongly recommend vegan diet to all my patients.
okay. That's a
plant-based food. You can enjoy this cashew nut milk and almond milk. You can make coconut milk. You can make even the coffee. You can take the coconut oil. You just taste it. You will really remember my words that you make the coffee with the coconut oil, and you will enjoy it. You will forget coffee of other this animal milk and coffee. It's really very, very tasty from coconut. Coconut is full of calcium. This system is full of calcium. There are so many things which are rich in calcium. Why we should take the calcium from the animal? Only due to calcium that calcium is going to produce these joint pains. All this osteoporosis, osteopenia is due to when we stop giving milk to when we say by patients that they should not take milk, and osteopenia is reduced, osteoporosis is reduced, joint pains are gone, and for the bone health. And even one study is there that who takes the animal when there is some bone is broken, and when there is a fracture, so the healing is more in the person who is taking the plant-based diet, is pure vegetarian. If a person is non-vegetarian, healing of this, why? What is the answer of this? We have studied. Everybody knows when there is a fracture, if a vegetarian person, healing is very quick. But an animal, the person who is taking the non-vegetarian diet, healing is very slow. Why? Because if that's this animal food, because it is acidic. The animal food is totally acidic. The acidic food, they will make the pH value of the blood, that should be less than more than 7. 7.5 is the normal pH value of the blood. And alkalinity we have to maintain the alkalinity. When we take the animal food, this pH value will come down. It will come 6 or 5. It will come down. So to maintain that, brain will send signal to the bones to give calcium. So we take the calcium from the bones.
Okay. That's very interesting. A lot of information on
very
diabetes.
Interesting. Okay then. So Okay.
Yeah, no, that was amazing. A lot of good information you gave us today on diabetes and what to eat, what not to eat for both type 1 and for type 2. I think the only little thing we didn't cover is there was one question I had about type 2 diabetes who have also nephro problem, kidney problem. They cannot take the juice, you're saying, because you said the juice is made up of leaves, green leaves of spinach and amaranth and all that.
Very slowly. They should take very, very slowly, not quickly. Because glycemic index, we have to take care of the glycemic index also. Na? They should take this, and juices should be taken very, very slowly, not quickly. Even when the juice is having some, this plant-based juices are not sweet at all.
But
Even
no, but the people with nephro, kidney problem.
We say that coconut, it should be taken very slowly and slowly, not quickly, because that will increase the glycemic index. No,
but the people with type 2 diabetes who have kidney problem, like diabetes patients who have kidney issues, they have nephro problem. So they cannot take the green leafy juice, vegetable juice, like that you said. They cannot take spinach, right? With the kidney problems.
Very, very interesting question. This is the big mistake in the modern practice, that they even stop giving coconut to the patient suffering from the kidney problem. I have cured the patient of the renal failure by giving them this coconut water, fresh plant, these juices, because they are not based on the main cause of the kidney problem, creatinine levels. When there is a renal failure, they only think of potassium. That potassium is which is coming from that. They don't understand what is the source of potassium. The plant-based source of potassium is really miracle for a kidney patient also. Even this coconut, but it should be taken very, very slowly and slowly. Not in the. They should take coconut water in the early morning, but at the same time, this pure vegetarian diet based on the fruits and the raw vegetables. The raw vegetables are ultimately going to heal it. But when we give the cooked milk, cooked food we stop. We don't say, we always say that a kidney patient should not take more this. There's so many other causes also. No? We have to find out the cause of the root cause of the kidney problem. For example, there's one plant known as gokru. There's tribulus. It's a plant, and it's very rich in calcium, potassium also. But it is wonderful. It works like a miracle in the kidney patients. You will be surprised to know there is a medicine known as Sarvatobhadras. Sarvatobhadras is a drug of choice for the kidney patients, because it contains a lot. It contains gold also, but according to the modern system, they say that there's all bhasams and these metals, they should not be given. But we cure the patients of the renal failure with the Sarvatobhadras. When we give Sarvatobhadras to the patient, the levels come down. So you cannot compare the source, which type of the source we are giving the potassium from the plant. If it is from the plant-based diet, it's really very good. Like coconut and yes, if the GFR is more, GFR is very important, glomerular filtration rate. If GFR is more, we stop giving them smoothie. We say them to take this dudhi. Dudhi means this ghia, this what you call ghia is God. This rich god or bottle god. All these type of gods are very good for the person who is suffering from the kidney problem. God like ghia, this kaddu, you call it kaddu. This ash god, pumpkin. All the climber plants are climber. They don't contain the uric acid, having very less nitrogen. All the climber plants, that is rage god, bottle god, all gods like the climber family, climbers, they are very, very good for the patients suffering from the kidney problem. But they are also having potassium. There's no doubt about it. So plant-based diet is wonderful. It's not harmful, but it should be uncooked. It should be in the form of juice, but it should be taken very slowly and slowly. Any juice, when we give it in the, it should be taken about, even in this coconut water, I say that 1 glass should be taken, you should take about 15 to 20 minutes to be taking sip and sip, very, very slowly and slowly you take this coconut water, not quickly.
Okay, so kidney patients can take kaddu and lauki and all these things.
That's definitely, it's very good. It's good. We recommend them. I give the ashgard because it makes the alkaline media. We need alkalinity. This modern conventional system, they don't feel it that what is the media? All because medicines are based on the chemicals. So this chemical medicines are very, very dangerous because due to the chemicals, there are so many patients are suffering from the kidney problems. We have to maintain the alkalinity of the blood. Most important part of curing the disease is very, very, very important is what is the pH value of the blood, because blood is 7. Having the pH value. That is why this ozonated waters and they are doing miracles. Ozonated waters, they are alkaline. We have to maintain the alkalinity of the food. But if you take Coca-Cola or Campa-Cola, you know what's the pH value? 5, 4, 3, 4. Like this is very dangerous. When we take Coke, the pH value it becomes acidic. It causes osteoporosis. It is the cause of the kidney failure. Even this drinks are more dangerous than this coconut. The soft drinks are more dangerous because they are acidic, and that causes the harm to the kidneys. All chemicals are going to harm, because when we have maintained the alkalinity of the blood, that is the target. When we give raw vegetable foods that like coconut, it is going to maintain the alkalinity, and alkaline media is very, very, very good for the health of the kidney. If the blood is acidic, you are giving some acidic food like tinned food. You are giving coconut water it is having lot of preservatives, lot of flavors and all that. That type of tinned packet food is very, very dangerous for the kidney patients. More than anything, refined food, this industrial food, the food which is directly came from the farmer, and we are taking apple, you are taking papaya, you are taking some any vegetable in the raw form, like cucumber, you are taking tomato even. The raw form is miracle. Raw form is because, you know, there is an enzyme in the stomach that is known as incretin. When we take anything which is raw, and this enzyme talks with the incretin, it says that I have come, I have this thing with me. I have this much calcium, this is sodium, potassium, so many enzymes all are there. Then incretins give traction to that food, which is living food, that you should go there is a need. And the things which you are having, that will repair that part. But when the food is dead food, that is cooked food, that is VIP food, very important person's food. One is known as DIP food, disciplined, intelligent person's food. When you take DIP food, that is the raw food, it will talk with the incretin, and incretin will give the direction that you should go there and that there is a need of this type of food. Okay, but when we give this cooked food, it will go without talking with incretin. It will go as a whole. That's why the cooked meal, that increases the sugar levels, and that increases damage to the kidneys and all that. But when we give the raw form of the potassium, and that will talk with incretin, it will say that this is not needed because there is already potassium is more, or this sugar is more. They will send it to the liver and detoxify it, and then to the it's just throw away to the urine and this fishes. Because that will because you have to remove it. Your body don't want it. So that is why when we take something raw, it is having enzymes, and it can talk with the incretin. That is the wonderful phenomena given by God. That how that is called in Ayurveda. We have got the Kadari Kulya Nyaya. We have Khale Kapot Nyaya. Khale Kapot Nyaya is the one Nobel Prize has been given to this phenomena. How the distribution of the food is there. And one person, this is Ayurvedic principle. On this principle, one person has got the Nobel Prize for the distribution of food. How this Kadari Kulya Nyaya and the Khale Kapot Nyaya. Khale Kapot Nyaya means there's like pigeons come and take the ingredients, which ingredient is needed. So one is khale kaput, the every from the ras dhatu to rak dhatu, mas dhatu, med dhatu, asthi dhatu, majja dhatu, this utrotra circulation of the food. So there are two nyayas are there, but when we take which is raw food, incretin will talk with that, and then it will go to the particular part where there is a need. But which is not needed, it will be thrown away from the fishes. Okay.
Okay. Okay.
Yes.
That was
I think it is clear to you. Incretin, the law of even a person a few days back, a lady came to me. She asked that the cabbage, there is a lot of poisons they put on it. You say that we should not cook this cabbage. There was a question of cabbage, and she asked me that cabbage which is uncooked, uncooked is more safe than the cooked cabbage. If you will take cooked cabbage, it will not talk with incretin. The poisons which is the cabbage is having, it will penetrate into your system. But when you will take the uncooked cabbage, even if it is having poisons, but incretin will say that that cabbage, that molecule should be removed from the testes, not through the stool. And this if it is cooked, it will not. It will directly go into the different tissues, and it will damage, because it is having poisons in it. But if it is raw, the poisons will be removed through the stools. So it is better to take raw food than to take the cooked food. So the animal food is, most of the animal food is animal proteins. For example, we take casein. Casein is not going to be broken. The protein which are based on the plant-based, they are broken into amino acids. So they will be, then the resynthesis will be there. But when the food which is we take from the animal, that is directly absorbed into the blood, and the brain sends the cells, phagocytes, to kill that, to digest that molecule of the animal-based protein. So similar type of protein body sees in the body, that is the cause of the autoimmune diseases. All these autoimmune diseases are due to the animal food. So I strongly recommend to take the plant-based food, so the proteins, so that there should not be any autoimmune disease. You know, so many autoimmune diseases, sarcoidosis is there, nephrotic syndrome is there, this many, even type 1 diabetes is an autoimmune disease. Autoimmune diseases are increasing day by day. Scleroderma is autoimmune disease. Nephrotic syndrome, ulcerative colitis is there, Crohn's disease is there. These are all autoimmune disease. These are due to the non-vegetarian food, animal food. So I strongly recommend the patient to take the plant-based diet, so that there should be less number of the autoimmune diseases.
Okay, that's very interesting to hear. For diabetes, what to avoid, what not to avoid. I'm thinking if there's any other question I have in mind. I think like you covered almost everything about raw food, though, like people with like aggravated vata should not be taking raw, though. Aggravated vata.
Vata, how you say it is aggravated by vata?
Like any disease that is aggravated by excessive vata, like Parkinson or any neurological disease or nerve disease or bone disease that is like rheumatoid arthritis or something. So they should not take raw food, though, like raw vata is aggravated by raw, right? Like vata.
No, this vata is no. It is a confusion again, that what if the food is having, what is the ras? If the food is having the rasa is the madhur amal lavan, the sweet, sour, salty will decrease vata. The food which is raw but having, for example, coconut it is madhur means sweet. It is having the earth and water in it. Earth and water is the combination of this the coconut. The basic elements are earth and water. So earth and water is there, it will reduce vata. Vata is made up of this ether and air. So if we are giving the natural form of something which is sweet in nature, it is not going to increase vata, even if it is raw. If you are taking mango, how it will increase vata? If you are taking coconut, how it will increase vata? Because it is natural sweet. if you are taking this chiku, how it will increase vata? It will not increase vata. Vata will be increased if the food is having raw food, which is bitter in taste. That will increase. That like Kerala. If you take Kerala raw, it will increase your vata. It will be very harmful to the patients suffering from Vatic disease, like Parkinson's and all that. Even if it is cooked, because that is bitter in taste. You know, this is the theory of Ayurveda, that Ayurveda says that has 6 sweet tastes: sweet, sour, salty, pungent, bitter, and astringent. So sweet like coconut, sour like lemon. Then there's salty like this any which is having salt like this spinach. So this type of foods which are natural source, sweet, sour, and salty, they are going to reduce vata because they don't contain any molecule of air in them. Then the bitter, astringent, and this katu means but pungent, bitter, and astringent. These all contain vata in them. The constituent of we should know the constituent of the rasa. Which type of rasa taste? Sweet, sour, salty don't contain air. That's why they reduce vata. Sweet and thick, this bitter and kashaya, that's astringent, they reduces pitta. And this bitter, astringent, and pungent, they increases vata, but they decreases the kapha. If we want to reduce the kapha in the body, we have to ask the patient not to take sweet, sour, and salty. Sweet, sour, and salty going to increase the kapha. Sweet, sour, and salty are going to reduce the vata, and pungent, bitter, astringent are going to increase the vata, but going to decrease the kapha. They are opposite to it. That's the importance of the this kinchadra same krute karam pakencha kinchana, then this prabhavencha kinchana, then viryancha kinchana. This is different. This is sutra in Ayurveda. That sometimes this is pharmacology, how the drug acts on it. So we cannot say that anything which is having bitter in taste, and the important part is that what type of taste is there, what type of the taste after digestion is there, what type of the virya is there, potency is there, what type of prabhav, empirical factor is there. This is the pharmacology of Ayurveda. It is not that easy question to say that this type of thing, raw thing is there and it is going to increase the vata. No, absolutely wrong answer. No, absolutely no. No question that everything which uncooked we take and that will increase the vata. No, not like that. If uncooked this coconut is going to reduce the vata. Your uncooked you're taking say, apple even, that is not going to increase vata at all. Because the taste is, what type of taste is there? If you are taking this Kerala or the jamun, it will increase vata. If you are taking it because it is having a bitter taste or it is having astringent, bitter, astringent, and pungent, that is going to increase vata. But again, there is virya also. Sometimes some things are very sweet in nature, but having the sweet taste, but at the same time they are hot in nature. That is, the potency is hot. The hot is there, then it is going to reduce vata. Even if it's something with, for example, this ginger is the taste is pungent. It should increase vata, but at the same time its potency is hot. So it is going to reduce vata. So this is the very complicated theory because it is only, we have to study for the 11 years of Ayurvedic studies, not that small subject. You are asking this question on the surface level.
I think sometimes it is also body to body type also. Like I was eating a lot of moong chila before, and it was okay with me.
That's why we see the prakriti nature of the body. Yeah, wonderful. Very good question.
Lately, though, I was having a lot of gastric issue, a lot of burping. And it stopped in the middle when I was not taking moong chila. I was like, I started taking some fennel and cumin coriander tea. It helped, and I started eating suji mostly with chila. So I would not take moong. And then I suddenly turned back to moong chila, and my burping start again. So
you are Vatic nature. Na? If your Prakriti is Vatic, you should not take these things which are in the form of the. If your Prakriti is very important, because if your Prakriti is Vatic, you should avoid the things which can increase Vata. So in that case, the importance is of the Prakriti also. We have to, when we see the patient, we see the Prakriti, Vikriti, Sar, San, Pranam, Satma, Sattav, Ahar Shakti, Vyam Shakti. There's 10 factors. Very, very important. It's not that easy that without seeing the Prakriti of the patient, we can recommend. If a person is having the Vata Prakriti and having the, that is why a person having Vata Prakriti and suffering from the Madhume, and the Ayurveda says that is asadhya. It is the prognosis is not going to be cured. So Prakriti is very, very important. We have to take care of the Prakriti, and then we can advise the this medicines.
Yeah,
That's
no,
very
like
important.
I have a
Because
Vikriti also right now of Vata. It's aggravated. Some doctor told me after looking at me that my Prakriti is dual. It's Vata and Kapha. Because I can also, like, my face structure and everything, like a lot of my tendencies are of kapha as well, because I'm
sometimes
lazy.
it's mixed also. You are right.
So
Prakriti is also important.
I could be really liking my comfort zone very much. So that is also very much like kapha. So he saw my face structure, my hair, oiliness and everything, and said that you are kapha and you have vata also. And right now vata is heavily aggravated. So I saw that moong dal chila actually was okay with me before, but as soon as the gastric issue arose, moong dal chila actually reverted back to gas problem. Like it cured for a while, and then as soon as I started taking moong chila.
But if you take the chila of this urad dal. Urad dal is guru in nature. So it is going to produce what a mash dal. This is called mash. You know, urad, black gram. Black gram is good for the vata people. You can
I
try
can take
vata.
black gram every day or no?
Black gram you can try that. That will reduce the vata, but it increases kapha.
Okay,
This
I
black
have a
gram
kapha.
increases kapha. But it is guru in nature. Guru means it is heavy. But it should be taken in small quantity. If you take in small quantity, it is going to reduce vata. For vata prakriti, we recommend ghee. This not for diabetes, but for general people who are suffering from the vata disorders, ghee is miracle for them. This clarified butter is very, very good. For person like you should take ghee. And persons who is having vata and pitta both, ghee is a miracle. He's the drug of choice. Because Ghritam Pit Anil Haram. Pit means pitta, this thermal energy. And Pit Anil means vata. Ghritam Pit Anil Haram Rashukar O Samhitam. It's Ojasvi. It's very good. In Ayurveda, we have recommended because it's full of so many micronutrients. So it is wonderful. We recommend it's the most healthy food for a Vatic person.
No, I started taking ghee, so it has reduced. Like I usually add ghee even on top of my khichdi and everything. So it's
very
definitely
good.
helping.
Really good. It will help you. Certainly it will help you. Okay.
Okay. Thank you, Dr. Gulati, for being on the show. I'll stop the recording.